18 minutes to 7. Would you put up with being paid $300 a week less than others in your profession? Well, registered nurses who work in aged care are doing exactly that, and they've had enough.
Well, the pay shortfall means that fewer fully trained nurses are in the industry, leaving less qualified staff to pick up the slack. So what is the answer? Well, Kearney joins us from the Australian Nursing Federation, along with aged care worker Lucille McKenna. Good morning to both of you. Jed, if I can with you, just run through the different workers there are in the aged care profession.
Well, Mel, there's a range of workers in aged care, right through from assistants in nursing who typically have a Certificate 3 education, through to enrolled nurses and registered nurses who are educated in the university sector, through to directors of nursing like Lucille, who's with us here today. And each of those workers bring really special skill sets to aged care, and a set of skills that is very important. And what we're concerned about in our campaign, which we're launching today, the Because We Care campaign, is that we have the exact right mix of all those skills, of all those workers in aged care, so that residents, vulnerable elderly people, get the very best care that we can give them.
Now, you want a national licensing system. Why is that needed, do you think?
Well, a licensing system is about professional recognition. We've been talking a lot to nurses and carers in aged care lately, and they're feeling a little bit undervalued for lots of reasons, and pay, as you mentioned, is one of them. But professional licensing is a way of recognising their professional skills of all workers, but it's also about putting a legal framework around what nurses and carers do in aged care and protecting the public, protecting the community, and protecting the elderly citizens that we look after.
Lucille, do you see all of this on the front line? I mean, is there extra pressure on nursing assistants to do more than they're qualified for?
Oh, there certainly is, yes. It's in recent years there's been an evolving role for these workers, and I mean, much of this work is carried out in the community where there's very minimal supervision, and there's also been an increased role in the low-level care facilities where we now have ageing in place and people having much higher care needs. So we have these workers actually needing to perform at a much higher level than they have in the past. And because there's now less registered nurses, which is backed up by the aged care workforce census, we have less supervision and you know, a changing face in the in the way that the care is delivered.
So, Jed, is it having an impact on the standard of care?
Well, what we know, Kochie, is that about 70% of people in nursing homes now have very high care needs, very complex medical health conditions. But that's not to say that we don't need all workers. We need a range of all workers in aged care. And as I said before, each worker brings a very special set of skills. I think the trick is, and this is what we're wanting to work with industry, with the providers and with the government, the trick is to sit down and work out, well, exactly how many of each nursing care worker do we need, nurse or carer do we need in aged care. We are seeing a bit of an imbalance. The industry is relying very heavily on what we call the AINs, or the personal care workers in the industry, and to some degree that's just not fair that we're asking them to do a lot more than perhaps they're educated or want to do. A lot of them don't want to be asked to do things that they're not prepared to do, where they know that a registered nurse or an enrolled nurse is needed. So the trick, I think, is for us to really sit down and work out, well, what do we need in aged care? How many nurses? How are we going to recruit them and retain them and keep them in the industry so that all our elderly Australians get good care?
Absolutely. And you're so appreciated by everyone who has sort of parents in aged care and things like that. We want the workers there really looked after. Thank you for joining us, Lucille.
No
Thank you,
worries.
Jen.
Thank you.
Thank you.
Thank you very much.
And good luck with your campaign.